This is Radio Health Journal. I'm Reed Pence. This week, how to fight your health insurer and win.
Nobody thought that I would win, and I sent it to the higher-ups at the insurance company, and 3 days later they called me, and they said, well, we're going to pay.
Getting what you're owed from insurance when Radio Health Journal returns.
Medicare and their list of suppliers continue to change, so if you have diabetes, it may affect where you get your testing supplies. But rest assured that your number one doctor-recommended one-touch testing supplies are always covered by Medicare Part B at your local pharmacy and select mail-order suppliers. Dr. Brian Levy, Chief Medical Officer at LifeScan, maker of one-touch products.
Some mail-order suppliers may offer a limited selection of diabetes testing supplies. They may try to switch you to a different brand, saying your current products are no longer covered. That's just not true. You are entitled to continue using the products you know and trust and that have been recommended by your healthcare professional at no additional cost.
Remember, you have a choice. Stay with the number one brand used by Medicare patients. For questions about coverage or where to get your one-touch testing supplies, call 1-844-942-2654 or visit www.onetouch.com/Medicare. Medicare Part B is not a guarantee of coverage and payment, which may be subject to coinsurance, deductible, and patient eligibility requirements.
For a lot of people, the healthcare system has become impossibly complex. That's why patient and healthcare advocacy has become not only more common over the last 5 or 6 years, but more necessary. A patient advocate, or patient navigator as they're sometimes called, is someone who does just that, helps the patient navigate the healthcare system to get the care they need. However, the field is so new, there's often little consistency from one service provider to the next.
The term is so broadly used now that there is no single definition.
That's Elizabeth Schuler-Russell, founder and president of Patient Navigator, LLC.
In a hospital navigator, their job is primarily to coordinate care within the treatment plan, within the facility, help make appointments, help arrange transportation if necessary, logistical and organizational help. And then at the private level, there are people like me whose services depend on how they structured their company. Some advocates focus primarily on cancer, some focus mostly on the senior citizen population. It really depends. Some do only medical billing and insurance advocacy. So it really depends on how the person structured their company and what their strengths are, what they like.
Russell says that for now, just about anyone can hang out a shingle and call him or herself a patient advocate or navigator. But she expects that will change in the near future.
There is no formal degree for this except the Sarah Lawrence. There are a lot of online programs that have sprung up in the past 6 years. But there is no national credential, such as a social worker would have a credential from his or her state and so forth. But an effort is underway to create such a national credential that will be recognized in every state. But it's been a long process because this is an infant profession.
According to Russell, there are only about 200 private advocates around the country. They're distinct from the clinically trained hospital navigators and those at community-level organizations such as the American Cancer Society.
We are not covered by insurance. Now, we probably save the insurance companies a lot of money by reducing errors, by knowing when a redundant test is about to take place, etc. But it's actually better because we work only for our clients and families. We have no conflict of interest with anyone. So we don't work for the insurance. We don't work for the provider. It's uniquely targeted to help the patients and families get the care they need and overcome any obstacles to that care.
However, once you've gotten the care you need, a lot of people still need an advocate to help navigate paying for it all. Dealing with insurance can be exceptionally confusing, and Russell says relatively few advocates are prepared for it. There's a lot involved in helping patients manage medical bills, explanation of benefits statements, or EOBs, and in many cases, appealing denied health insurance claims.
No, not everyone helps with medical bills because it's complicated and frustrating and time-consuming. And some people just don't like that part of the job. So I would say, when you're looking for an advocate, try to choose one who specializes in that work. because it's a universe unto itself, and it's very stressful.
Few people do it, yet Russell admits there's a great need for this particular kind of advocacy.
Once something complicated is launched, like a liver transplant or a cancer diagnosis, the medical paperwork is absolutely overwhelming. And you need to find a way to keep it organized and to know what you're doing so that you're not paying the wrong thing, so that you are being correctly covered by the insurance company. There are just lots of ways things can go wrong, and it's very stressful for patients to have to deal with that, and God forbid they have to get on the phone with the insurance company.
Fortunately, however, there are some healthcare advocates out there uniquely groomed for this type of work.
I have a background in pre-medicine and case management, also have a research background. I've always wanted to do something in a human service or humanitarian field, and appeal work is not for the faint of heart or for those who, don't have a bit of persistence and drive. We really have to work together and toward a positive solution.
That's Brendan Beatry, case manager for the not-for-profit Patient Advocate Foundation.
There are various reasons why insurance would deny a claim, and many of it, the basis is a lack of medical necessity, or perhaps it's a service that's outside of the standard of care or somewhat experimental or investigational. It may be a service that it's excluded or it's not on the list of covered drugs under a certain health plan.
So what do you do when that happens? Beatrice says when your insurance company pushes back on a particular service or treatment, get your medical team on board.
You want to make sure that you're both your primary and your specialty medical providers, whether they be physicians or a pharmacy or an imaging center or wherever that might be relevant, that they're on board and they understand that they need to kind of step up to the plate and provide medical records and perhaps a supportive letter if that's necessary.
Beatrice says patients and caregivers need to be well organized, but also well educated about their particular insurance plan and benefits.
Keep a chronology of their medical appointments or dates of service, and also understand that their health plan language, many of these, the long plan language that we get when we interview and are accepted for a job or employment position, we tend to, at least I did, push that plan language or summary back into the deepest, darkest drawer. But we do need to understand the finer language of it, understand what our limitations are, what our benefits are, if there are any exclusions in our policy, to get some kind of background should insurance actually deny a claim or service.
When I take a new case, the first thing I do is to read about a dozen scientific articles, because I want to know what this treatment is all about. Is there enough scientific evidence to support it? And I want to be sounding like I know what I'm talking about when I talk about it.
That's Lori Todd, author of Fight Your Insurance Company and Win. Todd doesn't call herself a patient advocate, even though she's successfully helped hundreds of patients. Instead, she calls herself the insurance warrior because that's the only thing she does, fight denied health insurance claims and treatments.
This is not something you go out and look for, becoming the insurance warrior. It came and found me. In March 2005, I was diagnosed with late-stage appendix cancer, rushed into surgery, and given months to live. And because I had an unusual cancer, they sent me to the chief of oncology at the HMO. And he said, there is no treatment for your disease. And even if there were, they wouldn't pay for it. So in that sentence, that's where and how the insurance warrior was born.
Obviously, Todd survived her cancer. She describes what happened next.
I knew if he said they weren't going to pay for it, that there must be a treatment. So I immediately went home and went looking for the life-saving treatment, which in my case was cytoreductive surgery and hyperthermic intraperitoneal chemotherapy. And then my insurance company denied it. So I spent 2 months inventing an appeal. And I thought, if my life is going to depend on this document, I'm going to create a document the like of which they have never seen.
Todd spent weeks reading her state's insurance regulations and studying both her insurance policy and the company's website. Only then did she write her appeal.
Nobody thought that I would win. Finally, it was ready, and I sent it to the higher-ups at the insurance company, and 3 days later they called me, which had never happened before. And they said, well, we're going to pay.
Todd got the life-saving treatment she needed and has since used her experience to help hundreds of other patients whose insurance claims and treatments have been denied. Her first piece of advice, don't wait too long to attempt an appeal with your insurance company.
first denial, that's when we start bringing into action. That's the very best time to do it. Now, that said, nowadays, I mostly get people who've had at least one denial already because they think it's going to work, you know what I mean? They think that this insurance appeal, usually they think their doctor can fix it. That's usually what they do. When they get a denial, they'll often say, oh, my expert doctor, he's going to take on the insurance company and do a peer-to-peer review, and they'll get it turned around. And that usually doesn't work anymore. So I'll usually hear from them after the doctor has lost the appeal. And that's fine, as long as they've got some due process left.
Todd and Beatrice disagree on some points about how and when to go about an appeal, but they both agree that it's crucial to keep calm and to take all emotion out of the picture. Easier said than done.
It all goes back to kind of neutralizing the situation, and, there's always a task at hand. So we'll need to assess where we are in the process, regardless of the patient's demeanor or behavior, and it's very understandable, perhaps. Just really get to kind of the crux of the issue and find out where we are in the process of obtaining access or approval for a given service, and just working with the insurance to handle it professionally and letting them know that now the patient has an advocate on hand and we can be the voice for the patient with regard to the process. That generally helps to kind of neutralize or somewhat stabilize the situation.
I think I want the world to know that you could probably do 1/10 of what I do and still win an appeal. If you just send it to a few of the right people, you keep all emotion out of your appeal, and you prove your case with facts, people do win these. It can be done.
And sometimes when emotions run high, a patient advocate can do a bit of damage control. In one case, Beatrice appeared in court on behalf of a young leukemia patient who was seeking unapproved off-label use of a drug in a last-ditch life-saving effort.
It was a really tense time. The patient was understandably in distress. We did achieve a positive outcome for the patient, but even then we had to do some work to enforce the ruling that the judge handed over and force Medicare to make that coverage, that approval, immediate and effective, so that the specialty pharmacy could administer the drug. So it was a very tense time. It involved the cooperation and compassion of a number of individuals on the advocacy side, on the provider side, on the insurer side, and we finally secured access for the drug for the patient. It was a win-win.
Many of us can probably think back on a medical emergency when our emotions got the better of us and we said or did things that only worsened the situation. So it's easy to see how having an advocate speaking on your behalf could be yet another useful tool toward healing and recovery. You can learn more about all of our guests, as well as Todd's book, Fight Your Insurance Company and Win, by visiting our website, radiohealthjournal.net. Our writer-producer this week is Polly Hansen. I'm Reed Pence.
Medical notes this week. An authoritative government agency says that for most women, an annual pelvic exam may be unnecessary. The U.S. Preventive Services Task Force questions the benefits of pelvic exams in women who have no complaints or symptoms. The task force says while there's little evidence in favor of pelvic exams, there's good evidence that exams sometimes lead to false positive results and unnecessary surgery. Experts say women should talk to their physician about their next pelvic exam, but in any case, an annual gynecological visit is still a must. It may be time to take canned foods out of your diet. A study in the journal Environmental Research shows the more canned food you consume, the more of the chemical BPA you are exposed to. BPA is found in cans and jar lids, and researchers say it's linked to many health concerns, including reproductive problems. Children are especially susceptible to hormone disruption from it. The U.S. Food and Drug Administration has banned the use of BPA in many baby products. And finally, revenge may be sweet, but a study in the Journal of Experimental Social Psychology shows that payback doesn't bring completely positive feelings. Surprisingly, we also feel bad when we carry out revenge. It's not that we feel guilty seeking justice. Researchers say it's because exacting revenge is a reminder of the deed that made us angry in the first place. And that's Medical Notes this week. More in a moment.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.